On this Sunday night, the needs of Canada's most vulnerable during the COVID-19 crisis. New measures to help children, seniors, the homeless, and victims of domestic abuse.
Tough times fall first and hardest on the most vulnerable in our communities.
What the government is doing to help. What lies ahead for hundreds of Canadian cruise passengers stranded at sea with COVID-19 on board. How COVID-19 could help shape the response to the other global crisis.
We've seen massive collective action around the pandemic.
And pandemic portraits of heroes, a Canadian photographer's tribute to our frontline workers.
Global National with Robin Gill. Reporting tonight, Colleen Christie.
Good evening. Thanks for joining us. The Prime Minister is offering a message of support to some of Canada's most vulnerable people during the COVID-19 pandemic. That includes children and seniors, the homeless, and those who can't stay at home because they're facing abuse or gender-based violence. He says his government wants to ensure no one is left without the help they need. Before we get to how he plans to assist them, let's take a look at the state of the outbreak in this country. As it stands so far, there are more than 6,000 confirmed cases of COVID-19 across Canada. Quebec is still the hardest hit with more than 2,800 cases. Ontario has more than 1,300. BC, Alberta, Saskatchewan, Nova Scotia, and Newfoundland are among the provinces reporting more than 100 cases. Nunavut is the only province or territory without a confirmed case. As all Canadians grapple with this crisis, the government will spend additional money on assistance for children and seniors. But as Abigail Beeman reports, some frontline workers at risk say they still don't have the support they need.
In Montreal, day shelters are being set up, expecting to see 1,000 homeless people a day. But frontline workers don't have protective gear, even though they say they've asked for it every day for weeks.
We're putting our lives at risk to help those that are most vulnerable, and we do it gladly, but we would also like the support.
And the vulnerable are who the Prime Minister focused on Sunday. He reiterated his $200 million commitment for the homeless. That money is flexible and can be used for COVID-19 protective gear.
We're not going to forget you. We'll work with the organizations you rely on, and we'll have your back.
Justin Trudeau also announced new money, $9 million for United Way to support seniors and $7.5 million for the Kids Help Phone, once again addressing children directly.
There are people in your corner making sure you're okay.
There are other vulnerable groups who need help too. One example, airline workers. Staff of Ukraine's largest airline don protective suits, but you don't see that in Canada. An internal email obtained by Global News from one flight attendants union disappointed in public health's recommendations says government officials haven't got a hot clue about what employees face. Infuriating, to say the least. Meanwhile, in an effort to help healthcare workers bracing for a further surge, a new message from the country's top doctor about those wanting to isolate out of town.
Urban dwellers should avoid heading to rural properties, as these places have less capacity to manage COVID-19.
And the strongest language we've heard yet from a federal minister about what Canada faces.
That we are in a situation of war, or similar to a situation of war.
British Columbia and Ontario have already taken steps to centrally manage their supply chains, while Quebec's premier has been using military analogies for a few days. On Sunday, he urged everyone to follow the battle plan. Abigail Beeman, Global News, Ottawa.
And a reminder, children in need of support or counseling during these troubling times can call the Kids Help Phone 24 hours a day. That phone number is 1-800-668-6868. Researchers say there's an urgent need to find answers to a controversial question surrounding the pandemic. It all has to do with how children contract and spread the disease. There appears to be growing evidence of kids being infected despite a low number of reported cases. As Ross Lord tells us, the push is on to find out why.
As she researches the impact of the new coronavirus on different age groups, virologist Alison Kelvin suggests something has been overlooked: the role of children. She says 3 studies analyzing thousands of children show they do get infected, but their symptoms are often so mild they go unnoticed.
The bottom line of this study is that children can be infected. We might not know that they're infected, and this might play a major role in the virus transmission.
In a scientific journal, Kelvin and a colleague say there's urgent need for further investigation to inform policies in the coming days, weeks, and months.
Perhaps we need to get out into the public and do some contact tracing with our children, looking at both how much virus they're shedding, what type of disease they're having, are they asymptomatic or not.
She says results could change public policy on decisions like when to reopen schools. Then there are daycare centers.
We have to think about childcare, the daycare workers that would have to look after children, and then again, kind of be on the front lines of this virus, where children might be kind of a silent carrier of this virus.
In some provinces, including British Columbia, daycares remain open. In most others, they're closed. Some are reopening for children of essential workers. On its website, the Public Health Agency of Canada says it's unknown what role children play in community transmission of COVID-19. There are growing calls to dig deeper and find out. Ross Lord, Global News, Windsor, Nova Scotia.
Earlier this week, the Prime Minister announced the government would spend $192 million on developing and producing vaccines for COVID-19. It's the critical solution scientists around the world are trying to find. Tonight on the West Block, Mike Lecouture speaks with Canada's Minister of Innovation, Science and Industry about the monumental task of global coordination.
What is your government doing to ensure that all of the information is being shared and everyone is working together towards getting that vaccine?
Well, we're engaged with the World Health Organization, and they've got the goodwill of many researchers around the world, and it's in our collective interest to work together. Not only are we focusing on vaccine development, though, and antivirals, but also production capabilities within Canada as well. In case we need to quickly transition to produce those vaccines here, we can do so.
The minister said it's too challenging to give a timeline on when a vaccine might be available because of the clinical trials that have to take place first. You can see the full interview on the West Block, hosted this week by Mike Lecouture. That's later tonight on Global. The federal government says a cruise ship hit badly by coronavirus will be allowed passage through the Panama Canal. The Holland America ship has 248 Canadians on board. 4 people have died aboard the MS Zaandam, and many others are experiencing flu-like symptoms. Passengers who are asymptomatic are being transported onto another ship. Canada's Foreign Affairs Minister says the vessel is on track to transit through the canal tonight. The ship is then expected to continue on to Fort Lauderdale. Another developing story tonight. Global Affairs confirms a Canadian was killed on a plane that burst into flames in the Philippines. It caught fire while attempting to take off from Manila's airport bound for Japan. The aircraft was carrying 8 people. There were no survivors. Airport officials say the plane was on a medical mission to bring a patient to Tokyo. They report a Canadian and an American national were on board, along with 6 Filipinos. Back to our top story. Just 1 month after the U.S. reported its first COVID-19 death, America has become the epicenter of the pandemic. The death toll doubled in just 2 days, and America's top infectious disease specialist is now warning that millions of people face infection and 200,000 could die. Already, more than 136,000 people are infected, and more than 2,400 have died from the virus. Late today, President Trump sent a warning to Americans, saying the worst is yet to come.
The peak, the highest point of death rates, remember this, is likely to hit in 2 weeks. Nothing would be worse than declaring victory before the victory is won. That would be the greatest loss of all. Therefore, the next 2 weeks and during this period, it's very important that everyone strongly follow the guidelines, have to follow the guidelines.
The president announced today that he is extending federal guidelines for social distancing until April 30th to try to slow the spread. Jennifer Johnson has the latest.
America, now the world's epicenter of the pandemic. In another attempt to contain hotspots, the Centers for Disease Control has issued a new 14-day travel advisory for people in New York, New Jersey, and Connecticut, the states with more than half the country's infections and nearly half the deaths.
This is not a lockdown. It is a travel advisory. It's nothing that we haven't been doing, right? Non-essential people should stay at home.
The travel ban does not apply to essential industries like trucking. Tighter restrictions aimed at slowing the spread of the virus expected to only get worse.
Looking at what we're seeing now, I would say between 100 and 200,000 cases, but I don't want to be held to that because it's deaths. I mean, we're going to have millions of cases.
The U.S. death toll doubled from Thursday to Saturday as cases of the virus skyrocket in big cities like New Orleans, Milwaukee, Chicago, and Detroit. Many governors say there is no way things will start opening back up around Easter time, as U.S. President Donald Trump had suggested.
The Washington metropolitan area has, Maryland, D.C., and Virginia, quadrupled in the past week, and we see that continuing to grow exponentially, and we think in 2 weeks around Easter, we're going to be looking a lot more like New York.
Hundreds on the front line are getting infected. Over 500 police officers in New York City alone. Cedric Dixon, the first detective to die from the virus.
We are hurting, we are crying, and we continue to fight.
Makeshift medical centers are rapidly being built by U.S. soldiers across the country as COVID-19 patients overwhelm hospitals. These beds are for virus-free emergencies.
We want to make sure that we can offload those patients to a hospital setting that is going to be safe and efficient for them.
With millions of businesses shut down, America's unemployment rate continues to rise. Experts say the virus could leave 20% of the country unemployed. The White House says it's hard to know.
It's hard to predict these numbers because we've never had anything like this where we've shut down the U.S. economy for medical reasons.
Americans facing uncertainty on both economic and medical fronts as they try to survive this pandemic. Jennifer Johnson, Global News, Washington.
Italy is reporting more than 750 new deaths today related to the pandemic, pushing the total number of fatalities past 10,700. Italy accounts for more than a third of all deaths from the infectious virus worldwide. The country's largest daily death toll was registered on Friday when 919 people lost their lives. There were 889 reported on Saturday. Spain's government has moved to tighten its lockdown measures as its death toll rose by 838 overnight. It's the country's largest one-day rise since the outbreak began, bringing its total number of fatalities to more than 6,600. All non-essential workers have been ordered to stay home for 2 weeks. Close to 79,000 people have now tested positive for the virus. India's 21-day lockdown to fight the pandemic is now taking a heavy toll on its migrant workers. Thousands of now unemployed workers in cities are crowding bus stations or resorting to hitchhiking in a mass exodus to return home rather than face starvation. The lockdown has affected millions of India's poor as many jobs like taxi services and housekeeping have been ceased. UN Secretary General Antonio Guterres is warning of potentially millions of deaths in Africa should the virus grow out of control. In an interview, he said there was an urgent need for more medical supplies on the continent and called on wealthier countries to help. There are more than 4,000 cases of COVID-19 across Africa, with lockdowns already in effect in South Africa, Rwanda, and the Democratic Republic of Congo. Coming up, how the COVID-19 pandemic may impact the environment for years to come. Did you unplug for an hour last night? It was the 13th annual Earth Hour, and more people were certainly at home than in past years. At 8:30 local time around the world, major landmarks went dark, highlighting the need to act on the other global crisis, climate change. Scientists have measured stark drops in pollution around the world since the COVID-19 pandemic began. Measures to curb the spread have forced huge drops in travel and commerce globally. As the world hits pause to tackle the virus, Redmond Shannon looks at how this period could help shape environmental policies of the future.
Venice is a magical place, but tourism means its canals are normally full of traffic and polluted. That was until the pandemic stopped everything. The clear waters, a glimpse into a cleaner past. The same effect can be seen in the air. Northern Italy is seeing a sharp drop this year in NO2, a toxic pollutant from diesel vehicles. A similar effect in China across many industries.
We saw operating rates that were about a quarter lower than usual at that time of the year. And all of that meant that CO2 emissions were reduced by about 25%.
As China ramps up again, the annual effect may not be huge, but it is helping scientists to see how changes in various sectors can affect pollution and greenhouse gases.
Yes, I think it'll give us an idea of how we're going to isolate different processes and how much they're contributing.
Roshin Kaman at Columbia University in New York has measured similar drops in pollution as the Big Apple hibernates.
It was quite surprising to see how much of the CO2 dropped, but the biggest change was in the carbon monoxide.
Even though airlines are mothballing their fleets and highways are empty, technology is allowing some sectors to continue almost as normal.
We're at an inflection point in the sense that we've seen massive collective action around the pandemic. And we also have the opportunity to reset the economy in a way that mitigates climate change. Governments could offer incentives to employers to allow their employees to work from home some of the time. And so that is something that we may see come out of this.
Lawmakers and industry will be eager to get economies back on their feet as soon as the pandemic is over, but they will also have more choices in how they do so. Redmond Shannon, Global News, London.
Just ahead, how to avoid some of the most popular COVID-19 scams.
You're watching Global National.
A warning tonight about scammers trying to take advantage of consumers during the pandemic. There are so many right now, so you need to protect your personal information and your bank accounts. The Red Cross is warning Canadians about text messages offering free face masks, saying, "Do not click on the links." Finance Canada says fraudsters are sending text messages about receiving a deposit from the emergency response benefit. Delete the message, it's a scam. Even Hydro-Quebec says scammers are sending emails and text messages threatening to disconnect people's power if they don't pay their bills. Do not click on the links because they often lead to fake websites or to an Interac e-transfer site. Up next, pandemic portraits, one photographer's tribute to those on the COVID-19 front lines. There are a lot of people on the front lines of the COVID-19 fight, including healthcare workers who put themselves at risk when we need them the most. A Vancouver photographer wanted to show his appreciation for their brave work, so he started a social media campaign to tell their stories. Robin Gill has more.
I've never been worried or scared in my life as of now.
I'm exhausted. A lot of the work that I've been doing is very much behind the scenes, preparing for the potential surge.
Forward, holding like that. Yeah, there you go.
They're healthcare workers, overloaded by the worst healthcare crisis in modern history. Outside the hospital, Vancouver photographer Eric Sadie is capturing the faces of this momentous time.
Wanting to create more positive content for social media. A lot of the, not negative, but just a lot of everything to do with COVID that's out there. I just saw this need to create images and at the same time showcase or highlight the frontline workers.
Sadie started the Humans of Support project. The photographs are intended to show an appreciation of what they're doing at work by profiling them outside hospitals, but also in places where they can't be, like the beach.
He's not here enjoying himself. Why are you? And if you're here enjoying yourself a little too much, there's more of you that are going to be heading to the hospital.
Sadie is starting the project with healthcare workers. Soon it'll be flight crews doing international runs to bring Canadians back home, not to mention the store workers providing essential services, and the list goes on. His work can be found on Instagram, and the response has been emotional.
I'm still absorbing it all right now because it's so surreal what everyone's going through.
His subjects are just as overwhelmed by the response, given the stress they're under.
You're just bombarded with doom and gloom. And so having like a beautiful little shining light in the midst of all of that, I think is a really, really important thing for us, for morale.
Thank you. But there's a message behind every photograph.
So I want to support and be an advocate in providing awareness to the community on how vital, how risky, how important is what we are doing inside the hospital, so that people would take their responsibilities more serious of staying home.
It's a responsibility both subjects and photographer are taking seriously, and hope that message resonates with the rest of the world with these photographs. Robin Gill, Global News, Vancouver.
We know staying home is critically important to our healthcare workers. Iconic Canadian band Bare Naked Ladies knows how hard it is to pass the time stuck at home. So they've done something special to brighten our spirits.
We know you're getting a little bored because we're getting a little bored. So we've come up with the Selfie Cam Jam.
We're going to leave you on this Sunday night with a bit of that BNL Selfie Cam Jam, along with the outpouring of love for our healthcare workers and their huge appreciation for everyone who is helping them during this dangerous time.
Thank you, when you love us in a dangerous time.
They're on the front lines of this fight, and they hear you cheering them on in Vancouver and other cities every night at 7 o'clock. The doctors, nurses, and support staff at Vancouver General Hospital say it keeps them motivated and inspired. And they add, thank you for staying home.
Gotta keep it the darkness till